Hello, good evening, good evening, good evening. Good evening, Bev.
Good evening, Paul.
Hey, everybody. Welcome to our health condition workshop. We are talking about autism and the Autism Spectrum Disorder this evening. Just a couple of things before we start is if you're here for continuing education credits, just put your name in the comment section so I can know that you're here. And if you'd like to make any comments, suggestions, this is a pre-tape beginning. Uh, just let us know, and we'll pass those on to Zaghloul. And because he was sort of, it was sort of distant. You need to turn up like you did. Turn up your speaker a little bit when we have Zaghloul on there. But I think you're gonna. It was a great little interview, wasn't it?
It was wonderful.
So again, if you're here for continuing education credits, just jot down there, make any comments you want. We'll have some discussion afterwards too, and then we'll teach you the points of how to work with these different aspects of autism spectrum disorder. So anything you'd like to say before we turn it on here?
No, I'm just, I'm really excited about this workshop. Zaghloul is just one of our really best friends here, and so excited to have him as our presenter tonight. Yes,
All right. And
looking
he is
forward.
a certified practitioner in Dubai. So we'll just
He
go with
definitely,
that and then we'll have a little discussion afterwards.
yep.
Okay, we're taping.
Okay. Hello, everybody. Thank you for being with us. Tonight, we are really honored to have a special presenter for this workshop, Zaghloul Abdelsalam. And thank you so much and welcome, Zaghloul. So great to be with you tonight.
Yeah.
So at this time, we're going to just let Zaghloul do his thing. Take it away.
Thank you, Dave. Thank you, Paul. Let me start with our greeting to say peace, mercy, and blessing of God. You are now morning, I'm in evening, so it's a greeting of love. Peace, mercy, blessing of love. Assalamu alaikum wa rahmatullahi wa barakatuh. That's our greeting.
Assalamu
Thank you.
alaikum.
So happy to be with you.
So Zaghloul, go ahead and give us your presentation on autism. We're really excited to hear what you have.
Autism, okay. Let's say ASD is a disorder of central nervous system and a type of developmental disorder that begins in the early stages of development, characterized by a deficiency in the development of sensory and language perceptions, which affect the individual ability to communicate and social interaction, the emergence of different behaviors, responses for environmental stimuli. Diagnostic criteria requires the symptoms become apparent before the child turns 3 years old. So autism affects the process of processing the data in the brain by changing how neurons are connecting and organized with their synapses. Unfortunately, science did not understand exactly how this happened yet. So autism is one of 3 disorders that falls under the autism spectrum disorder. So the second is Asperger's, and the most common is cognitive development and language delay. And the third is pervasive development disorder. And it's diagnosed in the absence of autism or Asperger criteria. According to the WHO, the World Health Organization, autism is prevalent in about 1 in 160 children In European Union, it's 1 in every 67 to 57. But let's say most of these statistics are imprecise, more or less from one country to another. So autism is a spectrum disorder. Every person with autism has a distinct set of strengths and challenges. The way in which people with autism learn, think, and solve problems can range from high skill to severe challenges. Some people with autism may need significant support in their daily lives, while others may need less support, and in some cases, live completely independently. We must, first of all, we have to differentiate between disease and disorder to know autism, how it is. Disease results from pathophysiological response to internal or external factors. A medical doctor treats and diagnoses disease based on abnormalities in the function of the body system. These we can say these deformities can use both physical and emotional signs and symptoms as well as pain and dysfunction. But disorder refers to dysfunction without a structure change in the body systems. And until now, since few months or until now, you can say science has not been able to identify an organ in the body that has a direct relationship to autism despite the appearance of symptoms. But it differs from one case to another and does not respond to the same treatment or the early intervention. With educational or behavioral training or adoption, so autism called a spectrum. It's not stable. In order to know more about autism, we must talk about the symptoms. It can be mentioned briefly, deficiencies, communication and social interaction, and in addition to specific behavioral patterns or abnormal sensory responses represented by social symptoms. In infancy, symptoms such as lack of response to their name, lack of interact or interest in people and interaction without them, and the delay in the first sound they make before the first words, difficulty playing social games and imitating the behavior of the others, difficulty participating in conversation and interacting with people on a delayed basis, difficulty interpreting what others think or feeling or seeing and understanding things from other people perspective, difficulty in regulating their emotion, communication difficulties, for example, delay in communicating and making sounds that precede before the first words, in addition to being late in learning and to use it, gestures, delayed language and speech skills, communicate with other verbally and non-verbally, use of speech in an appropriate context. Some people repeat without they hear verbatim and as an echo, which is known as an echolalia. They are repeating what they hear. There are challenges in social uses of the language, difficulties understanding body language, tone of voice and expressions that are not intended to be taken literally. They has also difficulty pointing out the things the child needs and the inability to share things with others. They have also, we can say, repetitive behavior. Repetitive behavior may include fluttering hands, swinging, jumping, turning, arranging and rearranging things, and repeating sounds, repeating words or phrases. Some people spend hours arranging the games a certain way instead of using them for play. Some adults get arranged in a certain way and in a certain order in the house, and may get very upset if someone or something breaks that arrangement. An intense preoccupation with something specific. These intense interests may appear in strange matters that interest them, scientific matters or details, information on a specific topic. Older children and adults may develop a keen interest in number, symbols, dates, or scientific topics. Abnormal responses to sensory stimuli in the environment, such as discomfort from sound they hear or light and contact with surfaces. There is also some signs in early childhood. We can notice it. Maybe the child in early childhood not paying attention when calling his name, does not smiling at him, does not make eye contact, does not refer to toys or his stuff, does not ask for what he wants using clear words until the age of 2 years or more, does not play games flexibly, makes a repetitive movement, as we said, like a flap. That's, I think, what we can say about autism. I think I got. Yeah.
So, Zaghloul,
Yeah.
can you tell us? You are a certified biotouch practitioner, so we're kind of interested too on how you feel like some of the other modalities or other holistic techniques like biotouch can maybe, how are you using that in your clinic?
Yeah, actually, to work with autistic, a range of therapies may help to treat autism spectrum disorder. Autism treatment relies heavily on behavior control, improvement of cognitive, scientific, social, linguistic skills training, sensory perceptions, speech session. At last, or we can say latest, all medication or drugs, the last period which stimulates the brain and improves the cognitive abilities of children with autism and helps them to learn and develop skills. It has also been used the sensory rooms and heavy metal withdrawal therapy. There are many newer medication such as palovartan. It's a new medicine, but all or most of this medicine treat specific symptoms such as hyperactivity or lack attention. But we have to say all medicine have side effects. Therefore, we recommend a self-healing, stimulating therapy such as biotouch and many other methods, along with a diet and educational behavior program. So autism is one of the disorders that we must use more than one treatment method. Here, I have a bias or prejudice towards the treatment with biotouch healing, which has continued and helped the development of many children and helped solve many problems. Significantly alleviated the suffering of these children But we have to say we work as a team. We work as a team. First of all, we receive referred cases from neurologists or psychiatrists or from school or from other centers. The team is made up of physiological or physiologist, an early intervention specialist myself, speech language specialist, a behavior adoption specialist, cognitive skills development, sensory issue specialist. Regarding me, specifically, I identified the child problems related to primitive and postural reflexes and work on integrating reflexes to help improve brain capacities and strengthen nerve connection and improve the function of the child body organs. And we use biotouch along with many other methods. We can say what is the relationship between biotouch and how to work with it in autistic. Most children with autism suffer from problems with intestine, digestion, absorption, and this we can solve this problem with upper and lower abdomen set point in biotouch. It's making amazing results. They mainly suffer from problem with brain processing, and it's very comfortable to work with the headset in biotouch. Many of them suffer from anxiety or tension. We solve these problems with the stress set and biotouch. Many of them have problems and allergies to food, and very helpful to solving these problems with metabolism and infection, sit and biotouch. In addition, some of them suffer from poor eyesight, headset, eye set, solving these problems. Most, or you can say a lot of them has hyperactivity, lack of attention, who we can call ADHD or ADD, are very helpful in solving these problems, metabolism, stress set, headset, that's making amazing results. That's very helpful for them. Actually, at least I can say only one phrase. It can be said the biotouch helps greatly in treating many problems associated with autism, which once a child able to learn, able to be developed, biotouch can be depended on as an essential part of dealing with autism. That's what I can say.
So let me ask you, Zaghloul, do you also in your clinic, how long have you been doing this now in your clinic? How long?
Sorry, I don't hear you clearly. Can you repeat, please?
How long has your clinic been open?
We are opening about 9 years now. Wow. We tried many methods with autism, with other Down syndrome, with ADHD, but actually when we start to use biotouch, it's about 1 year now, 1 year I think. Yeah. We made very amazing results. Everything became quickly treat, amazing for children. They feel more comfort. We solve a lot of problems. It makes a difference.
Wow. And do you teach the families to do this with their own children?
Actually, sometimes, as I ask you to allow to me to give some mothers some pictures of some points, yeah, we do. but not all of them asking that, because we are in this community. The families let the children with babysitters or something. Not always they depend on us to do this. Yeah.
Sure, there's enough stress already that they don't need more to do, right?
Right.
Yeah.
Wow.
Oh
Well,
man.
that was perfect. What do you think,
Thank
Bev?
you.
Any other questions
Thank
for
you.
Zaghloul?
Well, yeah, Zaghloul, you were just the poster child right there for biotouch. We are so grateful that you are part of this foundation and using biotouch in your specific field. Oh, it's just amazing what you're doing over there. Thank you so much. And
Thank
we
you.
really want to thank you for being with us and taking the time. We love you.
Thank you. Love you too. So happy you have me today.
Thank you very much.
Thank you. Thank you.
Woo-wee. Amazing. That was amazing. Are you there, Bev? I can't hear you.
Happy you have
Okay.
me today.
Thank you very much.
Thank you.
Are you there?
I'm here.
Oh, okay. We have there's a feedback here. Hold on here.
Okay.
Let's see. Amazing. That was amazing. Are you there, Bev? All right. There we go. I can't hear you.
Oh.
I'm getting a feedback. Why don't you put your headphones in there?
I'm here.
Oh, okay.
Can I put my earphones on?
Yeah. All right. So that was quite the experience. Yeah, I think that was it. Okay.
Okay. Could you hear me?
Yeah. Yeah, we were getting a feedback from that. That could have been the problem. So that was amazing. I'm telling you, what an honor.
I'm still getting feedback, Paul.
It's probably finishing
it's
up.
over.
Yeah.
It's over.
Okay. That's Zaghloul in
nope, I'm still getting it.
Dubai. Huh. Are you getting feedback? Who's listening?
I am. I'm getting. Oh.
How about now?
Yeah.
Probably.
Okay.
It's over. Yeah, it's over. No, it's coming over your thing there. Okay. That's Zaghloul in.
I'm still getting.
No, it's coming from it. You need to turn down. It's coming through your computer there.
I am. I'm getting. I took my earphones off.
Okay. So we're going to teach you some points now. Are you still getting feedback?
Oh my goodness.
We're going to, we'll end this here and then we'll just pick it up again to teach you the points. So we'll just stop it and start again. All right, we're back. And that was with Zaghloul. There was a little breakup in the, I don't know what was going on. He was out of sync too. And but here we are. You know, what? And that was with Zaghloul. There was a little break. Yeah, I don't know what's going on here. He was out of sync too. And but here we are. And that was with Zaghloul. There was a little break. Yeah, I don't know what's going on.
Can you hear me? I'm scared. Oh my gosh, there's so much back stuff. I can hardly hear myself. It's really it. Can you hear me? Oh my gosh. My goodness, Paul. Stuff. I can hardly hear myself. There's like 3 different things going on right now. Oh.
All right, so while Bev's getting it together here, we're going to teach you.
Did you hear that too or not?
Yeah.
All right.
It was coming through your.
We'll get this.
So while Bev gets this together, that was Zaghloul. He's from Dubai at UAE, and he has a clinic there, as you could see. One of the nice things about what he was presenting was.
Oh, I'm sorry. I must be my computer. I can just hear layers and layers of voices here.
Oh, okay. Well, we're just going to let Bev teach you here, and well, you can just talk. You don't have to listen.
Okay, I need to mute this.
Right. So Bev's going to just teach us the points, and you know, if you just were able to listen to that.
I don't think they can hear me.
Yeah, they can.
Yeah. Okay. All right. Okay.
So you just can't hear them. You can't hear me. So go ahead and teach.
All right, everybody. Sorry about that. Wow. So if you want to get the workbook, I don't know if couldn't hear Paul, so I don't know if he told you, but you can go onto justtouch.com /workbook, and you can follow along with us, or you can just see it here on our screen. So tonight, of course, you saw the presentation on autism with Zaghloul, and this front page, we always want to give an overview of the health condition that we're going to be presenting. And one of our ladies on the board, Paula Taylor, she is doing these for us and doing a great job. So we really appreciate that. So you can look at this first page and you know, get the gist of what this condition is. So you'll have some information. So let's begin. For those of you who don't know a lot about BioTouch, we always want to kind of introduce you to what is BioTouch. We have, we'll follow these 4 bullets. So basically BioTouch is a very simple hands-on healing technique. You use the first 2 fingers of your hands and you touch very lightly on the skin, for those of you, just like a butterfly. And it really addresses any health conditions that the body can manifest. It's very, very non-invasive and lovely. So as we found out, true, you know, healing comes from a consistency. So over time, the body's going to respond and it will enhance its own ability to heal. That's the beauty of BioTouch. So let's just go over these bullets one by one so we can just get a little bit more information. So the first bullet, BioTouch is easy to learn. It is easy to learn. And we have had children become certified practitioners, which is amazing. We know, you know, healing is, it's natural, it's innate in all of us. So BioTouch is like, it helps us to be childlike when we are practicing with another person. It's just so beautiful and safe. And so children get it. They just seem to know what BioTouch is and how they can use it. The next bullet, BioTouch is a complement to any healthcare program. We've kind of changed a little bit of our language over the years. We've started saying that BioTouch is, yes, a complement, but it's also integrative. You can use it with anything, whether it's another modality or prescriptions or any specific medical care, diets, anything that you may be doing, BioTouch can really enhance the healing process. So it's holistic because it addresses the skin, the body first. And then what happens is over time, those other parts of ourselves begin to respond. And that's what makes it just really a holistic technique. The next one, BioTouch has no levels of ability. Everyone is effective the first time. I can't say that about a lot of techniques. The very first time you use BioTouch on another person, you are going to be effective. Wow, that's kind of amazing to think about, but this is why it's meant for every single person. There's no, specific, you don't need to have any knowledge of the anatomy. You don't have to have a command of medical terms. No special knowledge of any kind is required. And the BioTouch language in the manual is very specific to finding those points on the body that help relieve pain and stress. So every single one of us can do BioTouch. And this foundation is one of our purposes is to get this into the families with children, helping mom and dad helping grandma, grandpa, this whole family unit can use BioTouch, as well as your coworkers, people on the street, people you sit next to the plane. Of course, maybe that's a little difficult right now, but that will change, I'm sure. But so anyone, the moment you learn BioTouch, you are going to be effective in helping someone. That's totally amazing. And the last bullet, BioTouch requires no special preparation, belief, or state of mind. So again, the moment that you begin to use BioTouch, it just is. It's just a gift to you. You don't have to have any particular philosophy in life, a belief system. You just use those first two fingers, and as we say, you just touch. So that's basically a lot of just the basics of BioTouch as we're going to present and help you tonight to learn how to use it, not just for autism, but for everything. So, we are a teaching foundation. So let's just begin to address those sets of points for autism. Let me say that when you begin to practice BioTouch, very, very few little rules we have. Remember, you're always using the first two fingers of your hands. You want to wash your hands before you begin a session with somebody. You lightly touch on the skin and you hold those points for 6 to 8 seconds. And actually, that's it. That's all you need to know. And you can begin to start to use BioTouch in your life. So let's, as you'll see, these terms that we use in the manual, we won't go into these tonight. This is something that we use when we actually are training. But these are the types of terms that we use to find ways to use BioTouch from the manual. I will say this, the associate, as you can see, there's two people in this relationship. One is the associate, the one who performs the procedures. And then we have the recipient, the one who receives the BioTouch. And it's interesting because in the dictionary, it says, the associate is one often in the company with another, implying intimacy or equality, and one having an interest in common with another. Well, the equality is the amazing part of BioTouch. We say it breaks down all of our barriers between us. And of course, if you have an interest in helping another human being, that's all it takes. So let's move on to the actual, we're going to now begin to use BioTouch and learn the specific points. I will say one thing before Paul begins the video. The greeting is always used prior to anything else. It's very simple, but it is the beginning of this relationship between the associate and the recipient. So we always want to use the greeting before anything else. So let's have Paul go ahead and take us to the video.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be re-established. Then the session may proceed from where it was interrupted.
Yes, are we ready? Okay. So now that we've done the greeting, let's start to use the specific sets of points that we're going to use for autism. The first one is the headset. And of course, the headset is used because it is, I got to turn this off, I'm sorry, because it is conditions that are related to the brain. And as we know, autism includes that. So let's go ahead and let you watch the video on the headset.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge. Point 2 above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. Point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay, so now we've finished with the head. The next set that we want to use is the neck. And as you can see, it's used to address headaches and but we want to use this because those points really address those nerves that go into the head. So this is the neck set's always a good one to use along with the headset. So we'll watch the video.
The neck set is used for addressing most headaches, neck pains, and soreness of the upper back. These points are performed in matching fire on the large muscles that run along the back of the neck. Points 1 and 1 are halfway down the neck on the side of the large muscles. Points 2 and 2 are at the top of the neck on the side of the large muscles at the base of the skull. Points 3 and 3 are at the bottom of the neck on the side of the large muscles. As with any set, you may repeat the points as many times as you like. These points may be touched in any order, such as touching points 2, then points 1, and finally points 3.
Okay, the next set is the metabolism set. And as Zaghloul was commenting that there are, a lot of physical things that come up with autism. The metabolism set is wonderful because it really helps the body to assimilate and get rid of and bring in. So we want to, it's going to be really good to use that for many, many cases. And let's go ahead and look at the video.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
So those are the 4 sets that we begin with, that we recommend for autism. And as Zaghloul commented on, different people, different things manifest with the spectrum order. And so, as he was saying, even some people have eye problems. You can do the eye set. If you want to learn BioTouch, we would love to have you. We have practitioner trainings all the time, our virtual practitioner trainings. You can download this workbook tonight. And, you can also become a member and get all of our health condition workshops that we have done, at least 50 of them, to address all kinds of conditions in the body. So I think at this time, I want to just ask you to if you have any questions, please contact us. We're so glad that you were with us tonight. Thank you again to Zaghloul from Dubai and the wonderful work he's doing there. And come and join, work with you and teach you BioTouch for your life.
Bye, everybody.
Bye, everybody.